Hello everyone. Let's start chapter 25 about the respiratory system. Respiratory system, as you know, it starts from the nose and is going to end up to your lung. Before we talk about different part of this system, let's first figure out what is the function of this system. Respiratory system clearly is used for breathing and exchange of gases. But also, as you know, as part of respiratory system, we have larynx that is going to produce sound. So sound production. Nose enables us to smell, so olfaction. Remember we talked about malt in the previous section. So respiratory system is going to help us to defend against germs that comes to your body. Knowing this one, let's talk about different part of this respiratory system. We said it's going to start from the nose. The air is going to come inside this tube. It's called pharynx. And then it's going to go to this part. It's called larynx. Another name for larynx is a voice box. And then it's going to go to this pipeline. It's called trachea. And then trachea is going to branch off and goes to each lung. Each of this branch that goes to each lung is called bronchus. We have right bronchus that is going to go to right lung. We have left bronchus that is going to go to left lung. This branches or bronchus is called primary bronchus because you will see inside the lung this bronchus or primary bronchus is going to branch off. The first branch after this primary bronchus is called secondary bronchus, and then it's going to divide into tertiary bronchus. Tertiary bronchus is going to divide more and more. Remember, we are inside the lung right now, just like the way that you see in this picture. Tertiary bronchus is going to divide more and more and create something that's called bronchiole. Bronchiole also is going to divide, and at one point bronchiole is going to end up to something that's called terminal bronchiole. So this is your terminal bronchiole. Terminal bronchiole is going to branch off to respiratory bronchiole. Respiratory bronchiole is going to continue as alveolar duct, and attached to alveolar duct we have a bunch of sacs are called alveoli. Gas is going to come from your nose and is going to enter to your trachea, comes to the primary bronchus, to secondary bronchus, tertiary bronchus, bronchiole, terminal bronchiole, respiratory bronchiole, alveolar ducts, and finally is going to get to alveolus, where we're going to exchange the gases. This is called bronchiole tree because it's going to branch off like a tree. The last thing I want to tell you about this picture is realize that we have a bunch of cartilages in the wall of the trachea and then bronchus. These cartilages start breaking up, but by the time we get to bronchiole, there is no cartilage. So in the lab, when you look at the slide, how do we know we are at the bronchiole level or we are in the bronchus level? Bronchiole doesn't have cartilage. Bronchus has a cartilage. If the cartilage is in the form of a ring and is complete, it's called primary bronchus. When this breaking up should be secondary or tertiary bronchus. Bronchiole doesn't have any cartilage. Now, knowing all this information, let's take a look at this slide. There are 4 different terminology that I need you to know. The first terminology is called upper respiratory tract. What is upper respiratory tract? Upper respiratory tract is from your nose all the way to the larynx. Anything below larynx is called lower respiratory tract. Why this one is important to know? Because we say if the patient has upper respiratory tract infection, not very significant, but if you have lower respiratory tract infection, you have to pay more attention. Upper respiratory tract, like common cold, is not super dangerous. Lower respiratory tract, like pneumonia, it becomes more serious. Also, we divide our respiratory system into conducting zone and respiratory zone. Conducting portion or respiratory portion. A conducting portion is where the air is being transferred down to the lung. So therefore, your conducting portion starts from the nose and goes all the way to terminal bronchiole. Air is going to come from the nose to pharynx, to larynx, to trachea, to primary bronchus, secondary, tertiary, and finally it's going to go to bronchiole until it's going to reach the terminal bronchiole. To the end of terminal bronchiole is called conducting zone. After terminal bronchiole is called respiratory zone. Why? Because respiration happens after terminal bronchiole. That's why after terminal bronchiole we call this duct as a respiratory bronchiole, because exchange of gas or respiration happens after terminal bronchiole. Can you exchange oxygen and CO2 in the respiratory bronchiole? Yes. Alveolar duct? Yes. Alveoli? Absolutely. So therefore, after terminal bronchiole, you can exchange gas. Therefore, we call this area respiratory zone. Remember, the most significant and productive part for exchange of gas, of course, would be inside the sac or alveolus. However, we can exchange gas inside the respiratory bronchiole and alveolar duct as well, although it's not going to be as effective as alveolus itself. Let's take a look at this picture. Here is a nasal cavity, and that is your pharynx. The opening of the nasal cavity to the pharynx, this area, is called choanine. Choanine is the opening of the nasal cavity into the pharynx. When you look at inside the nasal cavity, you can see a bunch of projections. You remember those projections? This is called concha, superior concha, middle concha, and inferior concha. Between these projections, of course, you have some depression, and that is called meatus. So this is superior meatus, middle meatus, and inferior meatus. Do you remember that superior concha and middle concha, these projections belongs to ethmoid bone? And I hope you remember that inferior concha is a separate bone. The opening of the nose, when it opens to the outside, this area is called vestibule. And the floor of your nose is composed of two palates. We call it hard palate and we call it soft palate. At the end of the soft palate, you have a tiny structure that hangs there, and that is called uvula. As you can see, this is your uvula. Also recognize your pharynx is composed of three parts. Part of the pharynx that opens to the nose is called nasopharynx. Part of the pharynx that opens to your mouth is called oropharynx. And part of the pharynx that opens to your larynx is called laryngopharynx. So we have three parts. Let's focus on the nasopharynx. Nasopharynx has two important structures. One is your pharyngeal tonsil. We talked about tonsil in the lymphatic system already. And also in the nasopharynx, you have an opening for auditory tube. Do you remember this auditory tube opens to the middle ear? This is your nasopharynx. And this is a tube that we mentioned already opens to the middle ear. It's called auditory tube. The second part of the pharynx is called oropharynx. And oropharynx is going to open to the mouth. In this picture, there is a term that I want you to know, and that is the opening of the mouth to the oropharynx from here to here is called fauces. In the middle of the fauces, you have your uvula, as you can see. We're going to talk about the structure of the mouth in the GI system, but for now, you have to understand in each side of the fauces, you have two arches. The arch in the front, this one, is called palatoglossal. Why is it called palatoglossal arch? Because it's next to the tongue. The back arch, this one, is called palatopharyngeal arch because it's next to the pharynx. Between these two arches is where you have your tonsil. It's called palatine tonsil. So we have two arches and we have a tonsil between these two. That is going to bring us to the last part of the pharynx, and that is the laryngopharynx. It's called laryngopharynx because it's going to open to the larynx. Again, larynx is called voice box because it has a vocal cord. We're going to talk about the structure of larynx in just a minute, but for now I want you look at the larynx here, and you can see there is a vocal cord here. This is the upper part of the larynx. This is the lower part of the larynx, which is going to continue with trachea. So from here down is called trachea. This area that you see here, I'm pointing out, is called the larynx, and vocal cord is right in the middle. This is the upper part of the larynx, and this is lower part of the larynx. Now, knowing all this fun, let me tell you what type of lining you have in different part of the pharynx. Remember, pharynx has three parts: Nasopharynx is lined by pseudo-stratified ciliated columnar epithelium. I hope you remember this type of epithelium. We talked about this one in the very first week of this school. In oropharynx, where the pharynx opens the mouth, you have non-keratinized stratified squamous epithelium. It's a stratified squamous, but it's non-keratinized. How about laryngopharynx? Laryngopharynx also is being lined by non-keratinized stratified squamous epithelium. And that makes a lot of sense. Why? Because remember that nasopharynx opens to the nose, and the only thing that's going to pass through this area would be air. You want the epithelium here to be ciliated to remove all the dust and particles that comes with the air. So it makes sense that this area is a ciliated columnar. The oropharynx and laryngopharynx is a tube that deals with food. The food is going to come from your mouth to the oropharynx, and then it's going to go to laryngopharynx. Finally, it's going to go to esophagus. So therefore, this area must be protected against friction that's caused by food. Therefore, it makes sense if it is area lined by stratified squamous. So therefore, the upper part is pseudostratified ciliated columnar, and the oropharynx and laryngopharynx are non-keratinized stratified squamous. Surrounding your nose, there's a bunch of cavities, and those are called sinuses. For instance, the maxillary bone has cavity inside. It's called maxillary sinus. Ethmoidal bone has cavity inside, but because the sinus inside the ethmoid is pretty small, sometimes we call it air cell, but it is a sinus anyway. Frontal bone also has a sinus. It's called frontal sinus. Sphenoid bone also has a sinus. It's called sphenoidal sinus. Look at this picture. Here is your frontal sinus, ethmoidal sinus, sphenoidal sinus, and maxillary sinus. These are the cavities that you have around your nose. This table shows different part of the pharynx and shows the epithelium that lines those areas and some characteristic. We went through this one already, so you can use this table to summarize those information. In this table, however, you have the rest of your respiratory system starting from larynx all the way to alveoli and tells you what type of epithelial tissue you have in each one of them. So let's go through this one together very briefly, and we're going to talk about each one of them in detail in a few minutes. Larynx. Remember we said larynx is divided in two portions, above vocal cord and below vocal cord. Above vocal cord is a non-keratinized stratified squamous. When we go below vocal cord, then we're going to have pseudostratified ciliated columnar. Trachea has pseudostratified ciliated columnar. When we get to the bronchus, larger bronchi, primary and secondary, they are lined by pseudostratified ciliated columnar. Smaller one, they're lined by simple columnar epithelium. Bronchiole, however, definitely is a simple ciliated columnar. As you go down through the bronchiole and get smaller and smaller, then instead of having columnar, we're going to change to cuboidal. So did you notice as you go through the bronchus down, first the number of the layers decrease from pseudostratified to simple, and then from columnar to cuboidal? When we go to respiratory bronchiole, definitely we have simple cuboidal. And when we go to alveolar duct and alveoli, we're going to change to simple squamous. So let's review one more time. Above vocal cord is non-keratinized stratified squamous. Below vocal cord is pseudostratified ciliated columnar. Trachea also has pseudostratified ciliated columnar. Large bronchus, the same thing, pseudostratified ciliated columnar. Smaller bronchus is going to change to simple columnar epithelium. Bronchiole, again, bigger one, is going to be a simple ciliated columnar. When we go toward the bottom one, when we get to a smaller one, it's going to change to a simple cuboidal. respiratory bronchiole, simple cuboidal. And when we get to the alveolar duct and alveolus, my cuboidal is going to change to squamous. So I'm going to change from stratified to simple, from columnar to cuboidal to squamous. I hope that makes sense. Now, that is going to bring us to the larynx. Larynx, or voice box, is composed of 9 cartilages. The function of the larynx is, of course, letting air to go through, but also it's going to make sound for speech because it has vocal cord. Larynx doesn't want to allow food to get through. Larynx is going to protect your respiratory tract to make sure food is not going to go through. Larynx can increase the pressure inside the abdominal cavity. I'll show you this one in just a few minutes. And finally, larynx participates in the sneezing and cough reflex. Let's take a look at the anatomy of the larynx. You're looking at the larynx from the front. Here you're looking at the larynx from the back. As you can see, in the front of the larynx, we have hyoid bone. That's the upper part of the larynx. The lower part of the larynx would be this cartilage called cricoid cartilage. So it starts from hyoid bone and it's going to end up to the cricoid cartilage. In the front, you can see there are 2 cartilages. One is thyroid cartilage, which is the biggest cartilage. And the second one is called cricoid cartilage, which is the lower part of the larynx. In the mid part of this thyroid cartilage, you have Adam's apple, which is bulged and you can feel it. But when you go to the back of the larynx, you can see that there are more cartilages. The most prominent one is this one. It's called epiglottis. It's a cartilage called epiglottis. Also realize that in the front view, cricoid cartilage is pretty thin, but the same cartilage in the back, as you can see, it has a very wide wall. So cricoid cartilage in the back is big, in the front is small. This is your cricoid cartilage. Do you see in the front is thin, in the back is tall and large? When you look at the back of the larynx, you can see sitting on top of this cricoid, you have 2 more cartilages. These cartilages are sitting in the back over cricoid, just like this one. These 2 cartilages are called arytenoid cartilage. It's an arytenoid cartilage. On top of arytenoid cartilage, you have 2 more cartilages here, and those are called corniculate cartilage. So how many cartilage do we have now? Thyroid cartilage, cricoid cartilage, that's 2. We have 2 arytenoid, that's 4. We have 2 corniculate, that's 6. We have 1 epiglottis, that's 7. And then we have 2 more cartilages that you don't see in this picture. I'm going to show you in just a minute. There's a membrane that goes between hyoid bone and thyroid cartilage. This membrane is called thyrohyoid membrane. Thyroid, hyoid membrane. So it's pretty easy to remember this one. Thyrohyoid membrane. Between thyroid cartilage and cricoid cartilage, we have another type of membrane or ligament that is called cricothyroid ligament or membrane. The mid part is called median and each side is called lateral cricothyroid ligament. Also, if you look at this picture, you can see the lateral part of epiglottis cartilage. There's a membrane that comes down and is going to go to the arytenoid cartilage. This membrane is called quadrangular membrane. It's a submucosa, is going to be covered by a mucosa. So this quadrangular membrane is submucosal membrane. Now, why this one is important, I need to mention, because the lower part of this membrane, as you can see, is right here. And that lower part of the membrane is called false vocal cord, or is called vestibular ligament. Vestibular ligament or false vocal cord is the lower part of this membrane. Again, this is a submucosal membrane. It's going to be covered by mucosa. The upper end of this membrane here is called aryepiglottic fold, because arytenoid, epiglottis, so that's why it's called aryepiglottic fold. So aryepiglottic fold is the upper part of this membrane. Vestibular ligaments is a lower part of this membrane. We're going to talk about vestibular ligaments or false vocal cord in just a minute. Now, as you can see in this picture, this side of the picture has the mucosa. This part, mucosa is being removed. So you can see submucosa. This area should be covered by a mucosa and it looks like this one, right? The reason I'm explaining this one because I want you to know when you remove the mucosa, you can expose another cartilage that we didn't talk about. That was called cuneiform cartilage. Cuneiform cartilage is embedded inside the quadrangular membrane. So if you want to see cuneiform cartilage, you have to remove the mucosa, and then by removing mucosa, you can see the cuneiform cartilage is embedded inside the quadrangular membrane. Remember, we counted 7 cartilage before. Now this cuneiform in each side is going to create the last 2, which altogether now we have 9 cartilages. In this picture, you can see a shadow of cuneiform cartilage here. And here's your cuneiform cartilage right here. This picture also shows that you have the mucous membrane and you see the shadow of cuneiform right here. So remember, this is arytenoid cartilage, this is a corniculate cartilage, and that is a cuneiform cartilage. If you go back to this picture, this is my arytenoid cartilage and sitting here in the back. The front would be thyroid cartilage. Did you notice that the arytenoid cartilage is like an L shape? This is the front, this is the back. The front part of this L, this piece is called vocal process. There's a ligament comes from this tip and it's going to come to the front and it's going to attach to the thyroid cartilage. Just like this one that you see. Do you see this line here? This is the ligament that comes from the vocal process and it's going to go and attach to the thyroid cartilage. That means from here it's going to come straight and it's going to attach to a thyroid cartilage that you have here. This ligament that comes from the arytenoid cartilage and is going to attach to the thyroid cartilage in the front, just like this one, is called true vocal cord, or is called vocal ligament. So vocal ligament or true vocal cord, just like this one. It starts from the arytenoid cartilage and is going to go and attach to what? To thyroid cartilage. So this is my true vocal cord. This is the one that's going to vibrate and is going to make sound. Now can you imagine that this is here and above that one you have another fold. This fold is above this vocal cord and that is the bottom area of this membrane. We call it quadrangular membrane. So therefore here this is my false vocal cord, bottom part of this quadrangular membrane, and this is my true vocal cord. You can imagine that if you bring this piece and attach it to this piece to complete this circle, because we open the trachea from the back and we are looking at the trachea from the back. If you bring this piece and bring this piece and attach them to each other to make a complete circle, then this and this, they're going to come close to each other. You're going to have something like this. This is my true vocal cord. 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 Remember, we cut this one, we opened it like a book. The space between true vocal cord is called rima glottidis. So this space is called rima glottidis. Between the true vocal cord and false vocal cord, this space is called ventricle. Below this vocal cord, we have another ligament that attaches to the cricoid cartilage. In other words, this ligament, which is called cricothyroid ligament, has a free edge at the top, and that free edge is your vocal cord. So therefore, this one must be cricothyroid ligament. Isn't it the cricothyroid ligament we just mentioned? Remember, cricothyroid ligament is a ligament between cricoid and thyroid. We said the middle part is called median, and each side is called lateral. So can you imagine when you go up, the upper edge of this ligament is going to create your true vocal cord. So true vocal cord is the upper edge of this ligament, which is right here. This is the cricothyroid ligament, and the upper part of it is going to create your true vocal cord. So make a long story short, you have a ligament from the bottom, you have another ligament or membrane from the top. The upper edge of this one is called true vocal cord. The lower edge of this one is called false vocal cord. Between these two is called ventricle, and the space between these two true vocal cord is called rima glottis. I hope this is clear and you understood. In this picture, you can see true vocal cord or vocal ligaments. You can see false vocal cord. The last thing I want to tell you about larynx, and then we're going to move on, would be some muscles that you have in the larynx region. I don't think you have to memorize the name of all the muscles that you have here. However, there are a couple of muscles that probably you want to know. Those are the muscles that control your arytenoid cartilage. Because remember, when you control arytenoid cartilage, you can control your vocal cord. Therefore, those muscles that are in contact with arytenoid cartilage would be important. For instance, you have oblique arytenoid muscle, as you can see here. Those are the one that attaches to the arytenoid cartilage. By controlling these muscles, you can control your vocal cord, and as a result, you can control your voice pitches. You can go high pitch, low pitch by controlling this muscle. I think that's enough about larynx. Now, let's move on to trachea. Trachea is right below cricoid cartilage, and this is your tracheal cartilages. When you look at the back of tracheal cartilage, you can see the cartilage is not complete. It's not a ring shape, but it's like a C shape. Between this end and this end of this C shape cartilage, you have a membrane. Why there must be a membrane behind the trachea? Well, because, as you know, behind the trachea you have esophagus. An esophagus is a really collapsed tube. When the food comes here, food needs to open up the esophagus and create some room for itself. So if the back of the trachea would be a cartilage, then you cannot open this space and create room for your food. But because here is a membrane, food can push this membrane in and open up the space. Therefore, the fact that behind the trachea you have a membrane that is going to allow esophagus to accommodate for the food and push this membrane in and create some room. I think I'm going to stop this recording and I'm going to finish this discussion in the next recording. I'll come back and finish this one in just a few minutes. Have fun.